from a regional and global perspective, and you have seen it in Singapore how this is being done in a very orchestrated manner in US as well, and a few other geographies that you are actually able to lend your expertise. Is there a specific success formula, if I can use the word, in terms of the rollout? Like, and we can say what has worked initially or what has not worked. Is there a way that we can have a relativity here, Michael?
Good morning, good afternoon. Michael Kalm-Seymour, based in Singapore. I've been in logistics 35 years, mostly in Asia, 20 years in Asia. A lot of my cold chain experience comes from Marken. Marken was specialized in clinical trial logistics. I've also spent time with the World Health Organization advising them on some of their emergency logistics around the Pacific Islands. And I'm currently the managing director of Roamby in Asia, which is a sort of Internet of Things tracking that, again, keeps track of vaccines. So my contribution here today, I hope, comes on more of a regional or global approach. I'm not an expert in India, and Sanjay and supply chain. Thanks, Sanjay. Well, I think if we look at the first country to really sort of roll out was the United States, and that was orchestrated. It was in my view, a very well planned public-private partnership. I remember watching the interview process where UPS and FedEx had to sit in a Senate hearing to be questioned on how they're going to roll out the vaccines. Does the packaging work? Do the temperature monitors work? I mean, if every country did that, we would probably have less issues. So it worked wonderfully. I think on the international community, obviously, then Europe picked up speed. And very quickly things did fall apart in Europe, but it was mostly political. Obviously, there's a lot going on in Europe with Brexit, with the UK leaving the EU. There were some delays coming from both Pfizer and AstraZeneca. There's been some questions on the efficacy of AstraZeneca. There's been some stop and go scenarios in Scandinavia. So this hasn't helped with the confidence of those some particular vaccines. But I think in general, some of the fears that we as a community were worried about, if you remember seeing lots of the international press saying we would need thousands of airplanes to help move these vaccines, that's not the case. I think the logistics industry has managed incredibly well. Countries have stepped up. If you see the arrivals of and I think that's the big difference with India. India is sourcing within India, so you have this national production going on, and the work seems to work very well. Most countries have to fly their vaccines in, and when it arrives at the borders, it's a sort of rock star arrival with the red carpet. The Minister of Health and the head of state comes to meet the airplane, and that's fine. The question is whether it's sustainable. If you when we get back to normality, and there's going to be potentially 10 or 15 companies producing vaccines, and it goes through the normal channels, can we keep that prioritization up? So I think those things worked well. I think what was really pleasing to see was the action that COVAX, particularly UNICEF, took. I'm sure you know that UNICEF delivers over 2 billion vaccines already in a normal year before COVID came around. So they are experts at this, and they have very qualified and professional partners from the logistics industry supporting them. But I think COVAX was something that's never been tried before. It was a monumental effort, and it's really pleasing to see the reach that COVAX has arriving into countries, at least to try to get that first 20% of the population. So if this was a sport, I would say we've got off to a good start. Still a long way to go, but there hasn't really been any, from what I can see, major disasters in the supply chain of the vaccine rollout.